Good morning, and my name is Jessica. I'm a pediatric trainee, and I'm delighted to have the opportunity to present here today. So our presentation is, I suppose, an overview of considerations in the delivery of healthcare to children with recognizable adverse social determinants of health. So to begin, I suppose, at the delivery of healthcare to inclusive healthcare to the marginalised members of society is both a global and a national priority. There are a number of ongoing emergencies at a global level, and some of which are related to conflict, economic instability, as well as the ongoing climate crisis. As a result, we're seeing year on year increased numbers of forced displaced people worldwide, as you can appreciate here on the graph. So at a national level, we're also having a number of crises, and there is a housing crisis at the moment. And you can appreciate here the month-on-month increase in the number of this graph specifically related to children who are relying on emergency accommodation. We're also seeing a big cost of living crisis, and we can expect that this will directly impact on healthcare outcomes. For example, with children and relating to food insecurity, how this is going to affect their growth and their development. We've also seen a large number of Ukrainian refugees who have arrived to Ireland with figures above 43,250 by the week ending 10th of July. And in addition to this, there's also an exponential increase in the number of international protection applicants in Ireland. So in July 2022, there was 7,760 applicants, and that's an almost 780% increase on the same time period last year. And these are people who are arriving into a system that was already at capacity. And additionally, I'd mentioned that with Brexit, although Ireland typically would have lower migration rates than the European norm, we are seeing an increase in secondary migration. So what does that mean at a local level? So Children's Health Ireland in Temple Street is located within Community Healthcare Organisation 9, which is one of the highest areas of deprivation nationally. And this is, I suppose, it's a hub for forced migration and for homelessness. And this is perhaps reflected in the number of emergency accommodation that are located within the vicinity of the hospital. And there's also a large number of organisations, both governmental and non-governmental, with their centres located in close proximity to Temple Street, such as Peter McVerry Trust, the Capuchin Day Centre and Pavey Point. And in relation to the social determinants of health, which obviously there are many and are well described, I just want to focus on a few that are particularly pertinent to the delivery of healthcare and perhaps in relation to barriers to people accessing healthcare. So to begin, as we mentioned, there's a housing crisis in Ireland at the moment. And with homelessness, it's obviously a very mobile population who are at times living in temporary accommodation, and people risk missing hospital appointments because they're not receiving the letters with the information to their previously given address. Transport is also an issue in accessibility to transport and affordability of public transport for people getting to hospital appointments. And there can also be issues with language barriers in the provision of healthcare. And unfortunately, there's not always optimal translation services available in hospitals in Ireland, and particularly in acute care settings. Education as a social determinant of health, and in relation to that, literacy and numeracy are also really important, I suppose, at a basic level in providing people with prescriptions and instructions on how to take medication. If you're advising someone to take 3 mils of a drug, if they can't count, then that's going to prove very difficult. So considering all of that, to deliver effective and sustainable healthcare, we need inter-organisational collaboration at both a governmental and a non-governmental level. So first, to look at governmental organisations, public health is obviously at the fore to this, and public health nurses in particular are, I suppose, the very definition of outreach care, in that they're attending people's homes and care settings and delivering healthcare to members of the community and enabling people to access healthcare. And general practitioners and primary care centres are obviously key as well. And multidisciplinary teams, particularly for children with complex needs who this team approach is really essential for them. And the HSC has a National Social Inclusion Office, which provides a number of supports and services to, as there's various groups, including people experiencing homelessness, addiction, Irish travellers, and Roma population as well. And the Department of Children, Equality, Disability, Integration and Youth have been key in the provision of services to Ukrainian refugees who have arrived. And a subdivision of that is IPAS, who support international protection applicants in providing accommodation and other associated services. And with that, the Balsescon Reception Centre has an initial health screening for people who've newly arrived into Ireland. And there's also many inclusion health teams within the acute hospital network, such as that in St. James's, as well as the HSE Health Link for the homeless, and obviously the Department of Education for access to education and the provision of additional resources for children as needed within education system. And there's also lots of pivotal non-governmental organisations involved in the delivery of this care. A number of charities which support children and families experiencing homelessness, such as Focus Ireland and the Peter McVerry Trust. Safety Net Primary Care is a medical organisation which supports marginalised members of society in accessing healthcare which they may otherwise not have access to. And Cross Care is a charity which provides a number of resources, including social welfare and housing supports. And they also have a subdivision, which is Cross Care Youth, which provides a range of services, including education to children and young people, for example, in relation to addiction. And they also support children and young people in accessing education and furthering that education, as well as employment opportunities. So in terms of our figures at a national level, in most recent figures, in August of this year, there was over 3,300 children who were accessing emergency accommodation. In July, there was 3,220 children who were seeking international protection in Ireland. And by the end of the first week in August, there was over 17,266 Ukrainians up to 19 years who had registered in Ireland. So I suppose to summary, I would say that there's obviously, as we've highlighted, significant numbers of children with recognisable adverse social determinants of health in Ireland. And there's clearly a need for tailored interagency healthcare for children who are at risk of social exclusion. This requirement for integrated service delivery has been recognised by Children's Health Ireland, and at present a hospital workforce who are trained in recognising and in mitigating these social determinants of health is currently under development. Thank you very much for the opportunity to present, and I'll be happy to take any questions afterwards.